cases of a rare disease called
Good evening and welcome to Sierra Leone Public Health Voices. Me na Fatima Kamara and we there this evening for talk on monkeypox. One sick wey don raise concern at the world and now we come to Sierra Leone. But we want talk in details and know wetin na monkeypox, how it is spread or transfer, how we go protect ourselves and who that more dey at risk. But I'm not going to talk much on that. And that make we get a health professional here. We will tell we waiting a monkeypox and then little things then there. So yes, I carefully introduce yourself.
Thank you very much, Fatima. Of course, me na Dr. Sorie Bundu and I work with different organizations. Initially, I start with the Ministry of Health. I'm the lead the disease surveillance control unit, and thereafter I work with supply chain and WHO as consultant, health specialist, and presently also at the double up with a program lead with Medtronic Labs International. So I appreciate so much for getting me this moment here. And lastly, I'm also an associate lecturer at UNIMAC. Thank you very much.
Thank you very much, Doctor.
Yeah.
So, Doctor, you able to tell waiting a monkeypox or waiting monkeypox really be?
Yeah. Of course, we all know about viral disease. Monkeypox now one of them. We the part of that category. We the part of viral infections disease, and similar to how we get initially. Sometimes before this time we get the smallpox. Some can associate also with chickenpox. And monkeypox is just one of it, and they discover we don't even know the source as at now. Ideally, with the scientists, them upon all numerous research globally. But there was a time when scientists did do research, and during that period, around 1958, they discovered there is an African form of disease where they affect human beings. It's related also with you get a linkage with zoonotics. So since then, we get that first case, which we call the index case in Congo, that in 1970. But they be discovered around 1958. And during that period to now, Congo, Brazzaville, don't they get many cases. The Republic of Congo don't they get multiple cases. And as at now, around May 2022, that's the time we begin get many cases them globally with the affect other countries them. And of course, quite recently in the sub-region, of course, you see other countries don't get in Sierra Leone, we still don't match up for get some cases as at now. Thank you.
Okay, so monkeypox different with smallpox or chickenpox?
Absolutely, yes. There are three distinct. Smallpox, they're on their own. They are all viral diseases, as I say, but monkeypox be specific, they're on their own. And but the signs and symptoms then similar. The only difference is to that of monkeypox. There is a difference for monkeypox because in this show there is a swelling limbs, with different, but they all get fever and also body rash as well. So they get some similarities and differences as well.
Okay, so monkeypox serious that much way we say people need for worry.
Oh, well, no. As at now, it would that make it different between in and smallpox. In respective of smallpox, we don't eradicate. Now, it is what we don't target for eradication around 1970, 80 earlier. Between that period, we don't eradicate them. But it be more severe as compared to monkeypox. Monkeypox gets a mild symptoms. Though, yes, of course, it causes some fatality. The fatality now 1 into 10%. So it's very mild. And of course, as I just told you earlier, the symptoms, they are something that we can manage as well.
Okay, so how monkeypox is spread or how it transfer?
Oh, thank you very much. It's direct contact. Most times it can happen through direct contact. When you get a direct contact with an infectious patient, person we don't get the sick already. So in an event, we are in like you be a caretaker now. When I get direct contact with the person, body charge, and the person is just he gets rash and he run fever as well. All those things. If you get direct contact with that person, there's a possibility of you also keep contact the monkeypox. There is another possibility of also like the object, the inanimate objects, them like the handles, materials, anything where the monkeypox patient, when as a monkeypox patient, don't touch. So you come in contact with those things because there is a mucus or fluid where they come up from the source of monkeypox, the pus. So that fluid, it gets 9 day the virus day. So if you get contact with those materials or objects, the possibility of you catching up monkeypox is great.
So now like a similar situation like Ebola, Tiadi?
I can say maybe based on the preventive measures and also the mode of transmission, yes, it's similar, but it's different because Ebola is a viral VHF disease, hemorrhagic fevers associated. But here is not a viral hemorrhagic. This one is a viral disease, of course, but as at now, as I just explained to you initially, there are sores, the scratch, where the person scratch. Understand? Yes, scratch the day. Then there is a lymph nodes problems with the swelling limbs. Of course, if that person it happen, say, it contacts those fluids, it's contagious. That's obvious, and we make a more different from that of Ebola, and even the symptoms they are different. They are not the same at all. So, but monkeypox is less worried as compared to Ebola. It has a less worried. So now make it easy, even as at now, there are cases coming up within the country, and the health professionals are doing all the best to ensure that they're able for control and also for investigate those cases earlier and ensure that they place those patients in a better option where they can give them supportive treatment.
Okay, so like how somebody will able protect himself where is somebody exposed? Like the market woman, then you say all day they jam body in the market, church customer, church the things the way they sell well and was not touch. I will able to prevent himself or protect himself.
Okay, so as a result of the direct contact, there is a possibility of people should not be more worried, but there are preventive measures. One, if somebody gets in contact, as I said just now, the materials, the objects, the way the person hold. And if you know this person na a symptomatic patient, the early infections, wherein you don't get the source they already did, and blisters they did. If he holds something, if you know, like an exposed community, because you don't know anyway. If now an exposed community, you get some precautions the way they take. And the precautions the way they take in those communities, you just need for do hand washing regularly, because anything you can go church, I can come on the crowd serious right now. I tried this seat mistakenly. So in an event, I can just go wash my hands again with soap and water, just like similar to the practices we do during the Ebola period, hand washing. There is a possibility of also introducing the vaccine, and which is also a very good practice, because if we did an exposed community by taking vaccines, it can help you as well. Also, it limits your exposure. If you don't see this area in a place the way we say people a little more will get the disease, if you limit the frequency of exposure there, if you limit them. That's also you will take care of the patient. So it's possible to say now at home level, because monkeypox, we can get people and we can even in our house, they take home remedy very well. But if you remember for be like let me say a caregiver at the home, anytime you play with any materials with that patient they get, if you make sure you wash your hands. If there is a possibility of you using hand gloves, you get them. They are accessible, you can use them. So for protect you more better off. And if you want to use a nose mask, irrespective of it not airborne, as that of chickenpox. Because chickenpox now only be an airborne way person cough or sneeze, you will contact them. But monkeypox is different from that one. So always make sure you take those precautions. Thank you.
Okay. So without more they at risk, like for picking them, or make people learn, or somebody where the system not strong again.
Monkeypox specifically is a target all age. I don't say get specific individuals where they look into like picking or adults or this all ages categories. They are vulnerable. Then two again, there is also a group of individuals where we say they are high risk, especially when you talk about sex workers. Understand? The like other categories of people, like you talk about the gays, they want to be practiced bisexuals. these are group where we see they are highly vulnerable with monkeypox.
Okay.
So those categories of individuals, the possibility of you contacting them for the you catch monkeypox is there. It's greater as compared to other groups. But they get specific, say, Peking or adults or this. No.
So, like somebody who don't see the signs and symptoms there, and in body say this na monkeypox, what is the person for do?
The person will see the signs and symptoms.
You see them either by yourself or another person.
Okay, yeah, you can report immediately. Now there is a channel. You get health facilities. In any community there are health facilities. So encourage them when they within your neighborhood that whosoever you suspect say it gets a monkeypox, or you based on their symptoms who don't present just now the signs and symptoms, if you see them kind of people in there, direct them at the nearest health facility. Though, if possible, also give them the necessary preventive measures we could do so that no will spread into your other families, immediate families. Though, if you get an opportunity of calling the 117, the hotline, you can report those cases. You can be an informant. You report, say, oh, we get like cases around the community are suspected. You direct the person to the facility as well.
Okay, somebody where you don't get monkeypox, you don't wear possibility they say you will get monkeypox again.
It's slim, except if now of different strain. This strain, as at now, where we talk about is a caliber strain, caliber IB, and this type one, the possibility of somebody for contact this particular strain again is slim, and will not get any proven evidence yet from scientists. But to be a safer part, if they cow the vaccine, take that advantage and take them up, and there's a possibility of you having a protection, immunity protection against yourself from subsequent exposures to even other strains they now.
So medicine they now for cure disease?
No, specifically as at now, we will not get any specific treatment for monkeypox. But we encourage people for go now hospital. Why didn't they go now hospital? Because there's a possibility of them having the opportunity for getting and diagnose them, then test them. Then two, if they test them, then say it's positive, they will treat them based on symptoms, the way they present. There is a when you present monkeypox treatment as symptomatic treatment in the game. If you say you ate the heart because of the fever, then they treat you so that it will lower the fever. If you join the heart, you get some body aches, you get fatigue, all those things. They treat you based on those ones. So the treatment, they treat you based on how you present your symptoms and your signs and symptoms. But we don't get specific treatment yet. And the good part about monkeypox again, it can even well without treatment. There are people when they recover, you get a timeline. You can reach certain stage, it diminish for yourself. So without treatment, it can okay. Preferably if you ever manage the fever, that's all it is.
But the possible say somebody go get monkeypox, you don't know. Where like the signs tell the show now?
Yes, at the initial stage. At that initial stage, because the exposure, the person can expose from week 1 to week 3. Within that period of exposure, the person that first 1 or 2 weeks, there are people who are not aware. Some are aware, maybe based on maybe it's the way you get some body aches now. Is this a fever continuously? It become intermittent. And later there are possibility, see, they put rash quick. Whilst that the other people, if they see the rash faster, they become the blisters. If they see them. So that's the other thing.
So, like, what the government don't need to do, or well, body people don't need to do for let them stop the spread of the monkeypox?
Yeah, there are many things. Of course, you see the National Public Health Agency don't heighten certain measures under the Ministry of Health, and partners of the involvement they critically for ensure that they support to see how best they put all hands on deck for curtail this disease. There are certain things where the government need to do. They don't do, especially for heightened surveillance that the various districts them as at now. And of course, initially there were early warnings. And as at now, regardless of heightened surveillance, there is also, they don't strengthen the alert line. People need a report, they get access for reports, all cases, and the hospital as well, then get specific area for admit them now as at now. Cannot they admit, they receive some patients, and the diagnostic, now this country, we thank God, we have a diagnostic center in Sierra Leone, and people have been tested here, and they've been also been treated here as well. So those are all opportunities.
Okay, thank you very much, Doctor. So, any last message we will give Ambule?
Yes, thank you, Fatima and the team. And I think one of the last message is for let we continue to encourage we people them. Let we leave that myth or that perception. See, when I get sick, I don't need to go to the hospital. They get hesitant of accessing the hospital. Let people them begin access the hospitals. And I'm pretty sure because of the lessons learned we get from Ebola and COVID, people are there is compliance. People now, as is sick, if they go to the hospital for a check. And I make it easy we get more turnout as it is now. And we don't hide cases, don't know hide cases. Now we access the health facilities them anywhere in the country, government facilities there. Make sure so you go there, the master service people they will help you for ensuring they give you timely response. I think that I did encourage people them, and I appreciate so much. Thank you very much for your time.
Thank you very much, Doctor, for the information. And Famule, the best way I think say you for able protect yourself. Now we get the right information. This na public health voices radio, and one for say plenty. Thank you for my attention. Stay blessed and thank you.
Welcome.